Now, for usually for this condyles, it is at the lower end, but for tibia, the condyles are at the upper end. Clear? And the condyles are not round; they are flat. So these are the two condyles. Now, which one is anterior? Which one is posterior? For this, first you should know. If you hold the condyles above, one side you will find everything is smooth, and the other side you will find there's a bulge here. Alright? This is called tibial tuberosity. What is this called? Tibial tuberosity. This should be anterior. Alright? Which side it belongs to? Now you know it is anterior. Which side it belongs to? You go to the inferior end, you see there is a small projection that comes here. Good. This is called medial malleolus. The name itself says medial malleolus. So this should be on the medial side. So this, what is that? Tibial tuberosity anteriorly, medial malleolus facing medially. So this becomes the left side. Understood? Okay. Now you know the side, you know the medial malleolus. So this condyle related to the medial malleolus, this condyle is the medial condyle. This is the lateral condyle. Got it? What are the important things? You will have two condyles to identify. Suppose I keep the bone like this and color this area or something and ask you, or keep it like this and put a finger and I ask you to identify which condyle. Look for the medial malleolus and you can say which condyle is this. Tibial tuberosity is one of the commonly asked structures because it gives attachment to
which tendon now?
patellar ligament, which is the tendon of quadriceps muscle. Understood? That is the place where when you tap, you
Knee
get
jerk,
what is known as
knee jerk.
knee jerk. Alright? So what is attached here? We can ask. What's the clinical importance also you should know. Clear? Okay. Now you see the two condyles here. You can see the medial condyle. It is slightly larger and more oval in shape. The lateral condyle is more circular in shape. See here, this is more oval. This is more circular. Alright?
Medial
Now,
lateral,
this is okay, fine. Now in between the two condyles, you see a small elevation.
Yeah, it's not very.
You see an elevation here.
Yeah.
This is intercondylar eminence or intercondylar tubercle, whatever you want to say. Clear? Intercondylar, okay, eminence or tubercle. We will keep tubercle. Intercondylar tubercle, right? Now why this is important is for two reasons. One, it will not allow the femur to slip sideways. Though it is very small, it does not allow the femur to slip sideways. That's one functional importance. Second importance is, this is anterior, right? Any doubts? This posterior. From this eminence here, you can see a small area anteriorly, a small area posteriorly, right? This is anterior intercondylar area, this is posterior intercondylar area. You saw ligaments there, right? Anterior cruciate ligament and posterior cruciate ligament. They are named because anterior cruciate ligaments take origin from here, posterior takes origin from here. Understood? Got it? Okay. Now, anterior surface, we saw tibial tuberosity, we saw the condyles, intercondylar eminence, two areas, anterior intercondylar area, posterior area, everything we have seen. Now let's go to the posterior part of the upper part of tibia. In this, you can see a line
Solely.
going from medial side to lateral side. You see a line?
Solear.
What is that line?
Solear line.
Soleal line.
Which one?
Yeah. Why it's called soleal line?
Should this one? This one?
Because of attachment of soleus.
Soleus muscle.
I know that you will answer,
This one.
but my question won't be that.
Looks like this
What
one.
is the structure attached above the line? That will be my question. All of you are shocked. Shouldn't be shocked.
Is it poppy?
It's a very, very simple structure, very important structure. It's one of the key structures.
No, is it poppy here? Suppose soleus.
You know, once upon a time, when we were young, we used to have quiz. All right. And nowadays, you don't have quiz at all. That concept is gone. That was very good. When we have quiz, they will have different teams. They will ask the question first, right?
Is it this? Oh.
Now I ask you a question. What is this? Immediately one team will press the button. Okay, what is the answer? They will say it is. What is this line? Next question. What is the structure that is attached here?
Soleus
To this
muscle.
line?
Soleus.
Soleus muscle. Next question is, what is the structure that is attached above this line?
Cantare. Cantare. Okay.
Nobody answers, right? So the quiz master will immediately say, clue 1. It is the key structure.
Truly one of the clues of our time.
Popliteus is the answer because remember I told you it is a key to the knee joint, right? So I use the same word key here in this position.
Oh.
Clear? So you should have thought about it and they will tell the answer. So remember all the other teams which are sitting there, even the audience who are watching, they will know key at this particular area means it is popliteus. All good things are nowadays gone, right? Very sad.
Good thing.
So
for
remember
this.
the
Quiz
most
that.
important
We will quiz that.
the most important question that can be asked at the upper end is always let's do on the posterior aspect. It is popliteus. Soleal line, popliteus. Alright? Then of course we have the shaft here. The most important thing that you have to learn on the shaft is you just come down from the tibial tuberosity, you will see a nice sharp border. All of you can feel the sharp border, right? Yes, that is the sharp border that you feel in front of your leg. Understood? Clear? See, in the entire leg, you will feel only one border. That is this border. This is called the anterior border. Now, why should the anterior border be very, very important? Because just to the anterior border, you see this part of the bone. This is called the shin. That is the part of the bone you feel below the
Shin bone
skin
lah.
here.
One shin bone.
Not chin, shin.
One shin bone.
Clear?
One shin bone.
This part is the tibia.
Nah, tibia lah. It's the tibia.
So see on the medial side, don't go to the lateral side, it's on the medial side. Medial malleolus, medial side. Now this area has got some critical importance. Clear? Then it is also for protection because if when someone attacks, the first place you should hit the person is always in the shin because it is below this bone is just below the skin and it is very, very painful. Clear? That is why you know you see the footballers whenever they cross immediately they catch hold of the shin first and lie down. Whether it's true or not, that is secondary. Right? Whether it's true or not, that's secondary. But remember, that's why whenever we want to incapacitate a person, someone is chasing us, hit the place and you run, he will feel difficult to run because of the severe pain. That is one thing. Don't keep hitting anyone and say this fellow only told this.
Normal
But
day in anatomy
what is the
class.
other importance is, remember, in case of pediatric cases, when we are not able to get pains, they always use
With the
this part
superficial
of the
veins.
bone to transfuse fluids. Clear? They put a needle into the bone and they allow
It's
IV
very
fluids
simple
to
to
pass
go
through.
in. And
Clear?
Enter
So
through
this
the
is also
anterior part.
important life-saving procedure for pediatrics. But not all pediatrics and very small babies. When we are not getting veins, pediatricians used to puncture this bone, go into the bone marrow and allow fluids to pass through. That will be absorbed by the blood vessels so that we can rehydrate the patient. Clear? So nothing is unimportant in the body. Clear?
Great.
Now
Except me.
coming to the lower end here, the lower end is very simple. You will have a malleolus. This is called the medial malleolus. Then you have the articular surface of tibia. From the medial side, when you come to the lateral side, you will have a groove for articulation of fibula. All right. These 3 points, all of you should know. This is medial malleolus, articular surface of tibia, groove for fibula. All right. Fine. Now, medial malleolus. Okay, all of you know what it is, where it is felt. I can color this area and ask you which bone articulates here. Talus articulates here. So remember, talus and tibia are the two bones which form what is known as ankle joint. Calcaneum does not form this thing, ankle
Talus
joint.
and tibia. Okay.
And ankle joint is what type of joint? How many movements are possible? Only 2 movements. Plantar flexion and
dorsiflexion.
That's all. So what type of joint it is? Hinge joint. Ankle joint is a hinge joint. So only 2 movements are possible. Then in the foot you have something called inversion and eversion, right? And that is from which joint? Is it ankle joint? No. Okay, what type of joint is knee joint?
Is it hinge? No.
Sure.
I don't think it's hinge. No.
Yes, it is called modified hinge joint. Knee joint is modified hinge joint. Why it's called modified hinge joint? How many movements are possible in the knee joint? 1, 2, 3, 4.
Yeah.
How many?
Is that the hip?
4. Sure? Yes, what are the movements?
Flexion.
No, I am asking about knee joint.
I don't think.
Flexion, extension and rotation. 3 movements will take place.
Oh, is it?
That's why this is called
Because we have
modified hinge
medial,
joint.
medial
knee joint.
rotation, lateral rotation.
Understood? Okay.
And go no, I know. But inadvertently also
Understood?
rotating muscle.
So these are the parts of tibia. Let's go to fibula. Is nothing much.